Here's a peripheral blood morphology smear from a patient with CLL, or chronic lymphocytic leukemia. Here at the feathered edge, we see that there are innumerable mononucleated, likely lymphocytes. And as we find our zonal morphology, there are some morphologic clues to indicate that this is chronic lymphocytic leukemia and not some other hematologic malignancy. You'll notice also the cytoplasm is relatively scant with a high nuclear to cytoplasmic ratio. As we scan around, you'll notice in the background there are a number of cells that are smudged or sometimes referred to as basket cells. These cells are produced by the relative fragility of these CLL cells. And this basket cell or smudge cell artifact can be corrected by using an albumin process smear. The albumin helps these cells to stay intact during the process of preparing a peripheral blood morphology smear. Additionally, as we scan around, I want you to take note of the highly condensed chromatin pattern seen in these leukemic cells. This chromatin pattern is relatively unique to chronic lymphocytic leukemia, or CLL, and is characterized by this densely packed nuclear chromatin. The peripheral blood findings characteristic of CLL include elevated white cell count, a variable number of smudge cells, and the absolute lymphocyte count is usually greater than 5 times 10 to the 9th per liter. A few prolymphocytes may also be present, and rarely a lymphoblast may be seen. At diagnosis, a normochromic and normocytic anemia is noted in about 20% of cases, and thrombocytopenia can be seen in about 10% of cases. Autoimmune hemolytic anemia complicates the disease course in just less than 10% of patients. By diagnostic flow immunophenotyping, the lymphoid cells will show characteristic immunophenotype with CD20 being weak and the surface immunoglobulin being weak. These cells are also CD5 and CD23 positive and negative for cyclin D1. The expression of CD38 and or of ZAP70 is an indicator of a worse prognosis, whereas the presence of an immune globulin heavy chain variable region confers a good prognosis. A number of characteristic cytogenetic abnormalities, including trisomy 12, deletion 13q, deletion 11q, deletion 6q, deletion 17p also may be identified. It's important when evaluating a case of CLL to keep your eyes open for any significant population of prolymphocytes. Prolymphocytes are characterized by a centrally placed round or ovoid nucleus, which may or may not be slightly indented, and typically show a single prominent nucleolus. Prolymphocytes also have a moderate amount of blue cytoplasm that often surrounds the entire nucleus, and rarely the cytoplasm may contain a few pink eosinophilic granules. Typically, prolymphocytes are not seen in a normal peripheral blood morphology and can be associated with chronic lymphocytic leukemia, prolymphocytic transformation of chronic lymphocytic leukemia, and prolymphocytic leukemia.